Okay, thank you for joining us today. Being here is definitely the first step to taking better care of your feet. My name is April Richardson. I'm the foot care nurse with the Wolf Creek Primary Care Network in Lacombe and also in Ponoka. I've been a licensed practical nurse for 15 years now and a foot care nurse for 7 years with the Wolf Creek PCN. And joining us today as well is Jessa Fiel, and I'll let her introduce herself.
Hello, everyone. Thank you for taking your time to be with us today. I'm Jessa. I've been a nurse for 6 years, and I'm the newest foot care nurse at Primary Care Network, and I am currently serving Innisfail and Sylvan Lake areas. I've been a foot care nurse for about 2 years now. So, yeah.
Awesome, thanks. And I will just let everyone know as well, this session is being recorded, and we're going to use it for some education purposes as well. Okay, so if you aren't familiar with the Primary Care Network, we are the Wolf Creek Primary Care Network consists of Rimbey, Ponoka, Lacombe, Innisfail, Sylvan, and Delburn communities, and we have a team of different healthcare professionals that work with the family doctors, the family physicians, and we work alongside them. And we have different free programs such as the foot care program, and we have dietitians, exercise specialists, psychologists, chronic disease nurses, a bunch of different professionals in different programs. So our foot care program here with the Wolf Creek PCN, we do focus on prevention of foot complications such as amputation of the lower limb, and we focus on foot health, education, and diabetic foot screening, and foot assessments, and addressing people's foot issues through one-on-one foot care appointments. We don't do basic nail trimming on a long-term basis, okay? With that, we are here today to educate you on your foot health, and we're going to talk about maintaining your feet and tips and tricks to having healthier feet. So we're going to just have a quick look at the agenda. So Jessa is going to talk to us first on common health problems leading to foot pain, common foot problems, a list of them. She's going to talk about circulation and neuropathy and how to help that. And then I'm going to go on and talk about skin, nail, and foot structure problems and what to do. We're going to talk about your footwear and preventative foot care tips and how we can take care of our feet better. And we're going to talk about modified foot care tips and tricks as well. Is there any questions before we get started? You're definitely welcome to ask a question throughout. Feel free to unmute yourself and ask the question, and we will do our best to answer it, and we will take questions at the end as well. So I will let Jessa go ahead and start.
Okay, so thank you, April. So now, if you are one of those people who may be wondering how your current health concerns affect your feet, then you're definitely at the right moment, because this is the first topic that we'll be talking about: common health problems leading to foot pain. So first, let's review some of these common health problems that can lead to problems with your feet. You or either your loved one may be experiencing some of these, and they may be causing you problems with pain or discomfort, affecting the way you walk, either the way you sleep, and even manage your own feet. One of the common example we have here in our list would be diabetes. So for people with diabetes, having too much glucose, or also known as your sugar in your blood for a long time, can cause some serious complications, including foot problems. Diabetes can cause nerve damage, which is also known as your neuropathy. and poor blood flow or circulation to the legs and feet, which is also known as your peripheral arterial disease. As a result, people with diabetes are less likely to feel a foot injury, such as a blister or even just a simple cut. Secondly, arthritis. So, what does arthritis do to your body? Must be a common question for some of us. So arthritis, it can either be autoimmune in nature, it could be hereditary nature, or it could be just the normal wear and tear of the body when we age. A healthy body has joints that actually contain normal linings or fluids that lubricate them so as not to cause any pain during movements. Now, with arthritis, what happens is this causes either overactivity of this lining, leading to swelling of the joints, or it could be a decreased fluids that serve as a lubricant, causing pain when we move. So eventually, this destroys the joints and the ligaments. These weakened ligaments then causes the development of your joint deformities. That's the reason why we started to show these claw toes, these hammer toes. There could be a collapse or a shifting of the bones. That's why we get all these chronic pains from arthritis. Next would be heart disease, which is associated with hypertension or the increased blood pressure. You have your high cholesterol or your edema or swelling, and your PVD, which we will be discussing more of that later. So with regards to heart disease, what happens to our body? What does it do? So with hypertension or increased blood pressure, it occurs when your BP rises and stays above the normal level over a period of time. With hypertension, often this is related to buildup of plaque in our blood vessels, which is also known as atherosclerosis, which is often associated with increase in your bad cholesterol. Thus, there is high cholesterol level, which may lead to decreased circulation and or peripheral arterial disease. People with decreased circulation in their feet or legs may then develop wounds that they don't even know exist, or even just simple cramping or pain in their feet or legs. Because of uncontrolled hypertension, this can lead to heart diseases as well, which may present as swelling on your feet or legs, then develop this chronic pain. This chronic pain, it could either be due to injury, it could either be due to overuse of a certain body parts or conditions causing inflammations involving any of the bones, ligaments, or tendons in your feet. Example of your chronic pain would be pain caused by arthritis, or it could be due to injury of the nerves or feet causing a very intense burning pain or numbness or tingling sensation, which you also know as your peripheral neuropathy. So a lot to deal with feet. Number 6, common foot problems. So we have our common foot problems. So April will do the slides for me. Thank you. So common foot problems would be bunions. You have your hammer toes, claw toes, mallet toes. These are, crooked growing toes, corns and calluses, dry, cracked skin, such as on your heels. There could be blisters, foot ulcers or wounds, your ingrown toenails, fungal infection, which could either be a nail fungal infection or a skin fungal infection. You have plantar warts, plantar fasciitis, athlete's foot. We will definitely talk more on these common reasons you may have foot pain later. Let's move on to explore some of the mechanics involved with foot pain. Number 7, we'll talk about circulation. So how does it relate to foot problem? Healthy arteries send oxygenated blood away from the heart and help keep the tissues healthy in our feet. The signs and symptoms of healthy arteries are a color flesh tone skin. Temperature on your legs and feet has to be warm all throughout. Hair growth observed on legs, feet, and even your toes. And you have to have palpable pedal pulses as well. But for someone with PVD or your peripheral vascular disease, things may be different. With PVD, it is a blood circulation disorder that causes the blood vessels to actually narrow, block, or spasm, often in our legs. Spasm would be just involuntary tightening of the muscles in your legs. So someone with PVD, you will see change in color of the skin or shiny skin on the legs. The temperature be cool or cold on both of the legs and feet, or even just on one side only. Hair growth observed on the legs and feet is reduced from before, if you could compare. Then you will feel leg or foot pain or cramping and swelling after walking on elevation. There could either be no pedal pulse or just a weak pulse. And then observe to have slower nail growth and sores or wounds in toes or legs or feet that are actually not healing. Now that we know that arteries send oxygenated blood away from your heart, the veins, on the other hand, push the deoxygenated blood back up to the heart and keep the circulatory system moving. When the veins are not able to send the blood back up to the heart fast enough, an individual may experience swelling in the feet as the day goes on. Oftentimes, relief is found by elevating the legs. Swelling is usually worse in the evening. So in that case, how can we improve circulation? Does anyone have any ideas or tricks that works for them in order to improve circulation? So now you can improve your circulation by the following. One, walking regularly. And then two, get up every 15 to 30 minutes when sitting. It's because sitting or standing for long periods of time puts added stress on the veins in your legs. Letting your legs pump blood back to your heart is a good idea. So that's why you want to maybe get up every 15, 30 minutes. Elevate feet throughout the day, which is ideally, it could either be at or above the heart level. This helps your veins. It helps keep the blood from pooling in your legs and improve blood flow to the rest of your body. Next would be wearing compression stockings. This helps push the blood back to the heart. Well, with this one, you may want to talk to your doctor. You may need a prescription and you may need to get properly fitted for this one because it comes on different compression depending on what is your need. So the next one would be review any toe, foot, and ankle exercises when sitting or standing. We have lots of exercises, but common would be pump ankles up and down, and then wiggle your toes while you're watching TV when your legs are elevated. Point your toes up and down, rotate the ankles in a circle for about 5 minutes at a time. You can even use a tea towel you can lay a tea towel on the floor and try grabbing it using your toes up and down on toes while you're holding a chair or standing up would be also another good exercise. So with that, one question, has anyone had any numbness, tingling, or burning sensations in their feet before? And anyone heard of neuropathy? So this would be a topic that I will pass on to April. Thank you. So here you go, April.
All right. Can you hear me, Jessa? Yeah?
Yeah, barely, but yeah, I
Okay.
can.
So talking about neuropathy, what is it and what can I do about it? You know, it's damage or dysfunction of one or more nerves that typically results in numbness, tingling, muscle weakness, and pain in the affected area. Sometimes it's worse in the evenings. There are many causes of peripheral neuropathy, including diabetes, chemo-induced neuropathy, hereditary disorders, inflammatory infections, autoimmune diseases, etc. But what can you do about it? Well, some people find it is helpful to soak your feet in lukewarm water and Epsom salts, but no open or closed wounds if you're going to do this, and 10 minutes maximum for that. You can roll your foot on a ball to stimulate the nerves, like a tennis ball. Some people find, you know, just massaging the feet once or twice a day, morning and night, with maybe some lotion. Maybe it has like lavender in it, something calming in it. Sometimes people will tell me often that exercise can help relieve some of the discomfort for some people as well. And it is very important if you do have diabetes to control your blood sugars. That does tend to help with the numbness and the tingling sensations. And of course, if you do have those sensations, maybe they're keeping you up in the night, you definitely want to mention it to your doctor, because sometimes there is certain medications that can help relieve some of that discomfort. We're going to move on and talk about foot problems and how they fall into 3 different categories. So we have skin problems, nail problems, foot structure problems. We're going to start with skin problems and what to do. So calluses and cracks, that is a very, very common one that we see a lot of. It is very important to be, I always tell my patients to be, when you have a callus on your foot, you want to make sure that you are filing that area 1 or 2 times a week, okay? And you can use a heel paddle. You can buy heel paddles in the drugstores or dollar stores. They usually have a handle and there's a flat black file, and you can reach your feet easier that way. And we'll talk about you know, reaching your feet when you struggle to reach your feet. We'll talk about that later on. And lotion, that is very important, okay? We want to use lotion on those dry areas to our feet 1 or 2 times a day. And you don't want to put lotion between your toes, okay? Just apply it to the dry areas. It's usually your heels, your ankles, and the pads of your foot. And after you put lotion on, put some clean socks on. Sometimes I hear people using those cheese grater files that you can find in the stores, and those are actually quite dangerous, okay? You don't want to be taking off too much at a time, and it really is the maintenance that you want to do weekly to stay on top of these dry areas. One of the people always ask us, what's a good lotion to use? Well, as nurses, we don't necessarily recommend a specific product, but I definitely do recommend, if you have cracks or calluses in your feet, you want to be using a moisturizer that has urea in it. 5 to 25% is best, and that's a specific ingredient. So you can check to see what you have at home if it has any urea in it. You can find different brands of lotion in the drugstores that have urea in them. You have to kind of look in the more specialty foot lotion aisle. It's not usually in the everyday lotion products. And one thing I do want to mention before we continue, that when someone that has diabetes, if they have a callus on their foot, they are actually 11 times more likely to develop a foot ulcer underneath that callus. So it is really, really important to be doing proper skincare, because those ulcers and those sores develop under those calluses and are a problem. And that's where we see open wounds develop really quite quickly, and infections and toe and foot amputations. So definitely address those calluses, okay? And we will talk about footwear as well, because that is a big problem, a big contributor to those calluses as well. Let's continue. Talk a little bit about athlete's foot. That also is a common one. What is athlete's foot? It is a fungus that actually causes itching, redness, cracking, peeling skin, commonly between the toes. Usually we see it around the 5th little baby toes, and in between those ones, the 5th and the 4th, and underneath. It really is important to be washing between your toes every day and drying really well between all of them. Clean, dry socks every day. If just the basic washing and good drying isn't working, definitely talk to your doctor. They may recommend a medication for the athlete's foot if it's not getting any better. There are some over-the-counter antifungal creams that may help as well. And it is good. I tell people too, when you're sitting down, if you're watching TV and your feet have been in your shoes or your covered slippers and socks all day long, it doesn't hurt to take them off, let them breathe, let your feet get some air, because that also is important. And definitely never put the lotion between your toes, okay? It just adds to that moisture and peeling of the skin. Corns, I don't know if any of you have experienced corns before, but they are frustrating. And basically a corn is a hard skin buildup. It's usually near a bony area of the toe, or sometimes in between the toes from rubbing, or on the bottom of the foot. They are a result from pressure from your shoes or your toes rubbing against each other, causing friction, okay? So proper care is definitely necessary if you do have a corn. So after you have a bath or shower, you can use a pumice stone to gently remove the buildup of some tissue. That helps a little bit. You can if you don't have diabetes, there are some over-the-counter corn remedies, but I don't actually recommend them just because they do have some acid in them and they actually can be quite dangerous. Don't try to cut the corn out or remove it with a sharp object. And the thing that you need to think about first off, if you do have a corn or a callus as well, is why do I have this corn or this callus in the first place? Well, it's usually a result to wearing poorly fitted shoes, or your toes are rubbing together. Okay, so your shoes need to be addressed, definitely. And if your toes are rubbing together, well, there is some toe spacer padding options. I have a screen on the screen right now showing some different options, but not everyone can see that, so I'll just talk about them. The drugstores, they do have some different toe spacer padding options. There's different little toe sleeves or toe caps, or even these little silicone toe spacer options. Sometimes they're in foam. Drugstores have all sorts of different options. Unfortunately, it is a trial and error to see what is working if you need one of those because you have a corn because the toes are rubbing together, okay? But if you have a corn on the bottom of your foot, it's likely because your shoes are just not properly supporting your foot, or if the corn is on the top of the toe and it looks like a hammer toe, that means that your shoe is not deep enough, okay? And foot ulcers. So foot ulcers are a problem. A foot ulcer, it's a break in the skin or a deep sore which can become infected. Foot ulcers can result from minor scrapes, cuts that heal slowly, or from rubbing of your shoes and not supporting your feet well enough, causing the callus like we talked about. Early intervention is definitely important in treatment of these foot ulcers, so definitely ask your doctor for advice if you do happen to have a wound on your foot. One thing that I want to mention again is calluses often lead to foot ulcers, sores, especially if you have diabetes. Foot ulcers, they can lead to infections and toe or foot amputations, and actually statistics show us that 85% of these foot amputations that are happening can actually be avoided through just good footwear and foot care, okay? And that's a huge percentage, right? So it's really important to take care of your skin. Let's just move, I'll just talk a little bit about cellulitis because that's also a problem. It's a bacterial skin infection. It usually follows, you usually get it because there's been a breach in the skin, such as like a cut or a laceration, sometimes even insect bites. So you definitely want to be checking your feet every day, watching for signs and symptoms of cellulitis are swelling, redness, pain, warmth in the skin, fever, infection. Okay, we see it quite a bit in the lower leg. So you do definitely want to keep that skin well hydrated and prevent skin from cracking. You want to prevent that skin against injuries or activities that may puncture the skin. You want to have good footwear. You can wear long pants so you don't get any insect bites. And if you definitely see any of these signs and symptoms like redness, swelling, pain, definitely go see your doctor as soon as you see that, okay? And individuals that are higher risk for that cellulitis, they are generally those that have that papery skin, it's shiny on the shins, okay? So you have to be really mindful of if there's any open areas. So moving on, we're going to talk about common nail problems and what to do. Did anyone have any questions about skin problems or any other questions you want to ask me before we move on to nail problems? No, okay. Well, let's continue on here. So common nail problems and what to do. So a common one is the fungal nail infection, which is also known as onychomycosis. And this is really common, okay? 1 in 5 Canadians are affected by it. 1 in 3 people who have diabetes will have it as well. Individuals who are immunocompromised are more prone to it. Reasons why people may get it. Well, first of all, what does it look like? Well, it actually looks like the nail is turning color. It might start to look white or yellow, discoloring in the corner. It might be really thick, and the nail might be really thick that you can't cut it. It might be crumbly. The nail might demonstrate to be loose or lifting, or that something is kind of stuck under the nail, and it can be brittle as well. So that's usually what toenail fungus looks like. And the reasons why people get it, of course, it definitely spreads, okay? So contact with an infected person or sharing nail clippers, you can get this nail fungus, okay? And it's a slow process. It slowly spreads over the years and gets worse. Some people that have like a nail injury to the nail, they're more susceptible to a nail fungus. And a lot of men, especially if they have excessive perspiration on their feet, they're more susceptible to the athlete's foot, which can lead to the nail fungus as well. Warm climates, moist environments, you know, wearing closed-toed shoes made of material that doesn't breathe can add to the causing of nail fungus. Walking barefoot in damp areas like swimming pools or at home or, you know, in the hotel shower. Those are some reasons why people do get it, but it is very common, like I said. So it's, you know, don't be embarrassed to talk to your doctor or a foot nurse if you do think you might have it. And it's very difficult to get rid of, okay, especially if it's fairly advanced. So if you think you may have it, you want to get on it before it gets to be even worse, because it spreads slowly over the years, and there's different kinds of nail fungus, and when you leave it untreated, it just gets worse, and it can even cause sores underneath the nail, and it often causes ingrown toenail infections because that nail starts to deform and gets thick and causes too much pressure on the corners. So definitely don't ignore it if you think you might have some nail changes like the yellowing in the corner. And there is antifungal medications that the doctors can prescribe, oral and topical. And some of them do help and some of them won't make a difference at all, whether you're using it or not. But it is worth a try to be using something, okay? And if the doctor doesn't prescribe you anything for maybe it's interaction with another medication you take, or maybe your body is getting a rash from it, or who knows what, if the doctor isn't prescribing an antifungal medication, some other treatment options are you can dab or spray some vinegar water, half-half, either white or apple cider vinegar, onto all the toenails once a day, okay? I find that that vinegar is pretty good at drying out the fungus and keeping it from spreading, and it helps make the nail more manageable if you're consistent with it. Other options are tea tree oil. You can dab tea tree oil on the nail once a day. Even some people use Vicks Vapor Rub, and that has actually been proven to show some effect as well in that nail fungus. It is an important thing to remember that if that nail is getting thick, it does need to be filed down. It makes it way more manageable, when the nail is filed down and you treat it with, say, an antifungal medication, topical, or even just the vinegar or tea tree oil, it sinks in better and does a better job if that nail isn't so thick, okay? And don't wear those old shoes that may harbor fungal spores. Make sure you have clean, dry socks every day. Wear sandals in public showers, pools, or locker rooms. And definitely don't share your clippers or nail files with other family members, and make sure you disinfect them after you use them. There are different kinds of toenail fungus. They do respond differently to various options. Definitely talk to your doctor if you are concerned, okay? And it tends to be a lifelong thing, unfortunately. Even if you have some success at getting rid of it, it can come back later on in your life. But it's definitely something that can be managed, and foot care nurses can definitely help you manage those nails. And moving on, we'll talk about ingrown toenails, because that's another really big problem that we see, very common. An ingrown toenail, it occurs when the edges of the nail grow into the skin and start to curl around, and they cause pressure and pain along the nail edges. The edge of the nail may cut into the skin, causing redness, swelling, pain, drainage, infection. And the most common causes of ingrown toenails are pressure from shoes. People that, they peel their toenails off, or they're cutting them too short or too far down into the corners. Maybe there was a toenail deformity due to injury or fungus and genetics. So those are quite uncomfortable. They hurt. So what's the best way to avoid an ingrown toenail? Well, definitely proper trimming of the toenails. We're going to talk on that. And keeping any thickened nail filed down to prevent pressure on the edges. And no peeling your toenail, and wear properly fitted shoes. And if you do have an ingrown toenail, what can you do about it? You can soak it in lukewarm Epsom salt water for 10 minutes maximum. You can put some antibiotic ointment on, like polysporin, for example. Wear comfortable shoes and socks. You can take an over-the-counter pain reliever. The corner of the nail that's digging in, it does need to be trimmed so it doesn't add to the infection. Usually there's a little hook that's digging into the skin that needs to be trimmed out. And if you don't feel comfortable doing that and you can't reach properly, or if you have diabetes, definitely see your doctor or foot care nurse as soon as possible. And there is with the ingrown toenails, there is the option of a nail brace to retrain the nail to not ingrow as much. And so that is also a newer, helpful option that's not invasive and good for someone that has diabetes and prone to infection. Common foot structure problems. Well, there's a bunch of them, you know, bunions, hammer toes, claw, mallet toes. There's lots of different deformities that happen. It's usually due to bony prominences, structural deformities, and they can force your toes to crowd together, rub on the side of your shoe, overlap different toes. And it's usually because of arthritis or genetics play a big role. Even wearing narrow shoes or high heels that, you know, high heels when you were younger, or shoes that were too tight and not supportive. And what can you do about that? Well, definitely you want to make sure your shoes are wide enough for your foot. No high heels. You can use a over-the-counter toe spacer pad option. Orthotics, professionally made orthotics, can help to remove the pressure on the pads of your feet and provide better support to stop callousing from developing. Some leather shoes can be stretched at the bunion area. And there is some surgical interventions, but it's usually kind of the last resort, okay? And you do want to address your footwear first. And again, I did show just a quick picture of some toe spacer pad options, but we talked about those. A toe crest is actually another good option if you have hammer toes, because with a hammer toe, it bends up and you end up walking on the tips of the toes, and you get calluses on the pads of your feet and the tips of your toes. And a toe crest is a little pad that sits underneath your toes. You can get them in the drugstores, and they help take some of that weight off, so it's not causing as much callousing. Plantar fasciitis, that's another common one. It's heel pain. It's pain and inflammation in your heel, and it's usually from wearing poorly fitted shoes, okay, indoors and outdoors. Some people that go barefoot can even get it in the house. There are different exercises and stretches to help, like rolling a tennis ball or a frozen water bottle under your foot morning and night. Let's talk a little bit about your footwear, because this is a very important topic. If you're going to buy some new footwear, you want to buy your shoes later in the day when your feet are the most swollen, okay? If there's somebody in the store to help you fit your shoes, definitely ask them, okay? It's definitely helpful to have somebody fit your shoes. Extra opinion does not hurt. The inner sole of your shoe, it should be removable so that it can accommodate a shoe insert or an orthotic. My husband actually, when he went shoe shopping with me, he brought a book because he knew he was going to be there for quite some time, because I tried on every shoe possible in Sport Check, and I took out all the inserts in the shoes and I put my own orthotic in the shoe and had to try on everything, okay? It doesn't hurt to give yourself lots of time, and definitely wear the shoes around in the store for 15 minutes just to test them out to see how they feel, because sometimes people will get them home and feel like, oh, these actually don't work so good for me. The heel cup should be quite stiff when you pinch the shoe, okay? I don't know if you can see this here, but you want to, when you press this in, squeeze it, you want the heel to be firm. You don't want it to be flimsy. The shoe should not bend in half, okay? It should not bend in half. Laces or Velcro are best to adjust the tightness, especially if you struggle with swelling. And don't forget to clean the inside of your shoes periodically. The inner sole can be removed. You can wash it with some mild soap and water, let it air dry. And you can also use a peroxide spray with water to clean it. And if you do have a new orthotic insert, make sure you wear it for only 1 hour a day and slowly increase that, because it can take, you know, easily 4 weeks to get used to that orthotic. I know when I got my last pair of orthotics, I did not like them at first, and I hear that a lot, that, you know, I got orthotics, but I don't wear them because they don't fit me. Well, that's what it feels like at first. They usually aren't comfortable, and so you need to just slowly wear them for an hour a day, slowly get used to them. And from personal experience, it takes a good month at least to start feeling like, oh, this actually is working really good. And now if I don't wear them, I definitely notice it. I don't know if anyone has a favorite shoe store in the area. Jessa, do you know any shoe stores in the Innisfail area or Sylvan that you would recommend? You guys don't have much.
Yeah, I'm not sure.
Yeah, there's not a whole lot of options. Yeah, I like, you know, Mark's Work Warehouse in Red Deer, Sport Check. There is the Shoe Chalet. There's a few different ones, but even actually PharmaSave in Lacombe, I know they have some PharmaSaves. They have some custom footwear options called the Padors, and those are really good for bunions and feet that have a lot of issues. And of course, it is definitely important to remember to replace your shoes if they are getting worn down on the tread, or if they're getting holes in them. Sometimes, even if they feel comfortable, you should still replace them, okay? Because if they're wearing down, you're going to be prone to injury. But also, I hear it a lot as well as being a foot care nurse. People will say, oh, my shoes are so comfortable, and they're awesome shoes, and they probably are great shoes for somebody else, but they have calluses on their feet and corns, and I think, and I say to them, well, you know, this is an okay shoe, but it's not fitting you properly because you have a callus on your foot, you have a corn on your foot. Even though they feel comfortable, it doesn't mean that they're working for you, okay? And definitely, you know, podiatrists and orthotists, they can help you with orthotics. Those are the inserts that can go into your shoe and professionally made for you. And there are some different options around Central Alberta for those. They do cost money, and sometimes people have benefit coverage for them. Socks. So definitely socks are important as well. It's always good to wear a sock in your shoe. White or gray color socks are best because you can see the blood on your foot, okay? A lot of people that have diabetes, they don't feel when there's an injury on their foot. And so sometimes that white sock can catch those injuries really easy because it sticks out, right? Socks do provide extra protection and support for your feet, especially in the arch, and they do reduce your chance of blisters or corns. They act as a barrier in your shoes, but you definitely don't want to make sure that they're restricting at the ankle area or leaving indents in your skin. There are diabetic socks in different stores, and those are a great option if you have any swelling in your lower legs. And if your feet have any moisture during the day, you can try a merino wool or Cool Max sock because they absorb moisture and help keep the skin dry a little bit better. Preventative foot care. So definitely healthy feet start with you properly taking care of them. People often forget that their feet need to be cared for, and that starts with some basic steps. And sometimes we just need a reminder of what those are. So definitely want to look at your feet every day. You can use a hand mirror or an extended mirror if you're unable to get a close look at them, or get your foot up high enough. Use a mirror. Check for open areas, cracked skin, calluses, anything that looks abnormal. And have you washed your feet today, right? That's something we need to do. And have a look at your toenails. Do they need to be trimmed? Are they growing long over the end of the toe? Are they rubbing on your shoes or catching on the sheets? Do you have a functioning nail clipper that you can use? Has it been used on just yourself, or is everyone in your household borrowing it? And when you cut your toenails, you want to trim them fairly straight across. You can cut them a little bit with the natural curve of the nail, but don't trim them far down into the corners. And just because there is white at the end of the toenail does not mean it needs to be trimmed off. Shorter is definitely not always better. And you can file your nails using a disposable single-use emery board to remove any rough or sharp edges. And when you file, you just go in one direction only, because back and forth, it can cause the nail to splinter and peel. And I really like the use of a heel paddle to remove any rough, dry skin on the heels or the pads of your feet. And make sure you wash and dry your feet well, making sure to get in between the toes. And again, no lotion in between the toes, and just lotion on the dry areas. And if you have diabetes, you should definitely see a professional foot care person at least once a year for a diabetic foot assessment or a foot screen. And you can also see a private foot care nurse on a regular basis for nail care if you're struggling to trim those toenails. Make sure you check your feet every day. Just because you don't feel a problem doesn't mean that there isn't. So modified foot care tips. This is a topic that it's a tricky one, because lots of people have problems reaching their feet, right? Maybe a family member does, and maybe it's a parent of yours or even yourself. Okay, there's lots of different reasons why people can't take care of their feet. Maybe it's or reasons why they don't take care of their feet, okay? Back pain, maybe they're overweight or they've had a hip replaced. Sometimes people complain of dizziness when they bend over, arthritis in their hands and their shoulders. So these are common problems that us foot nurses hear that lead to neglect and problematic feet. But there are some simple ways that you can learn to start taking better care of your feet. So we're going to go over some of those suggestions. And like I said before, your footwear is definitely a big factor in your foot health. So don't forget that, please. So struggling to reach your feet. Well, looking at your feet, people say to me all the time, well, I can't see my feet, so I can't do anything about it. Well, it's important to try, okay? We can use some different tools like an extension mirror. You can buy extension mirrors in PB Mart, different stores. Even just a long handled mirror or just a little hand mirror you can put on the floor, put your foot over top of it, you can see the bottom. If your eyesight is poor, definitely please ask somebody to have a look at your feet every day if possible. Even some people use a selfie stick and put their phone on that, and they can see the bottom of their foot that way and take pictures if there's any wounds, so you can monitor the changes. Washing your feet and washing in between your toes. So there's different long-handled sponge brushes you can get in the drugstores. You can even make your own. And while you're sitting on a chair in the tub, you can plug the drain. You can use a long-handled shower head to wash your feet. In the dollar stores, there's these long-handled kind of a foamy or a foam brush thing, or just there's lots of different ways to do it, and you can make your own. You can even use a paint stick and wrap a J cloth around on the bottom of it. You can put like an elastic band on the end of a paint stick. Just, you want to be washing and drying good between your toes. Drying between your toes. There's different toe dryer options that can be purchased, I know, through PharmaSaves. They can order you some, or you can make your own paint stick and a cloth, a J cloth, elastic. You can use a hair dryer at a safe distance on the cool setting, okay? But you have to be very careful with that. And putting lotion on your feet, there's lots of good ways with that. My favorite one for people that can't reach their feet is just a long-handled paintbrush, actually, a paint roller brush. You can put some lotion on that and roll it on the bottom of your foot. Sometimes people will use like a towel, put some lotion on a towel and kind of rub it around their foot, and easier way to reach your feet. You can even put some lotion on a plastic bag on the floor, rub your feet on that. You want to get lotion on those dry heels especially, okay? And definitely there is ways to get it on if you're living by yourself or if you can't reach your feet. Putting your socks and shoes on. There are some sock helpers you can get in drugstores. Bed Bath & Beyond sells a sock helper, and there's shoe horns you can use, long-handled ones. And same thing for compression stockings. There's a Donner and Doffer Magnite tool available. And trimming your own toenails. So I do find, some people, they try to do too much at once, and they're bending over for long periods of time to get down to their feet, and they get dizzy or short of breath. So if you can still bend and put your shoe on and touch your foot still, try, and you're struggling trimming your toenails, try just trimming one toenail a day, and not overdoing it all at once. Find a comfortable spot to do it in. If you have poor vision, you don't want to be trimming away down there and cutting and nicking yourself. Ask to see if a family member can help you safely, and there's also the foot nurse option to help you as well. And filing your heels and calluses. So you can make yourself a heel paddle with a long handle. You can use a paint stick, duct tape a heel paddle from the dollar store onto that, or even a clean sanding block and make a long handle. And some of the drugstores do sell long-handled heel paddles for your heels to file some of that dead skin away once or twice a week. So those are some little options that may help you if you're struggling to reach your feet. And if you can see my screen, I have some pictures of some different options of what we just talked about. Like I said, again, the long-handled paint roller, the shoe horn, the long-handled heel paddle, long-handled toe washers, extension mirrors, those sorts of things. And another one of our last topics that we're going to talk about is, what about a pedicure, and are they safe? Well, if you do have diabetes or you are prone to infections, it is very important to protect and educate yourself just to avoid those potential complications, okay? So while complications aren't common, you should definitely be aware that you may be exposing yourself to things like plantar's warts, athlete's foot, toenail fungus, Hep B and C, HIV, and staph infections. And so some questions to ask when you do book yourself for an appointment for a pedicure is, first of all, do you autoclave your tools, and do you use sterile or disposable tools with each client? And the answer should be yes, okay? When someone's working on your feet, they should definitely be opening sterile packaged tools up in front of you that have been autoclaved, and that they're sterile. They should not be taking a nipper or a file out of a liquid in front of you and using it on you. That's probably just a disinfectant, and that is not enough, okay? You're exposing yourself to some problems if they're not using sterile or disposable tools. And another question to ask is, are the emery boards one-time use, or are they sterilized in your autoclave at 270 degrees? The answer should be yes. If they don't know what an autoclave is, that is a problem, okay? And also with pedicures, you want to ask them, do you use disposable basin liners? And the answer should be yes to that, okay? Just disinfecting the basin where you put your feet into water is not enough. There's still bacteria that lives on there. It's not a sterile environment. And if you have any open cut, you are putting your foot into this basin where other people have put their feet, and the jets are going, and you're exposing yourself to all sorts of things. So please just be safe, and just know that where you're going for a pedicure, they're there to make you feel good and look good, okay? They're not necessarily always trained in the health of your feet, and you have to play it safe. Other quick suggestions, if you decide to go for a pedicure, don't shave your legs within 24 hours of a pedicure, because those pores of your skin, they are open usually, and they allow for entry of bacteria. Avoid those paraffin wax treatments. This treatment can cause blistering of your skin and leave open areas prone to infections. No Credo blades or cheese grater type scrapers, especially if you do have diabetes. And if you have any open areas to your lower leg or your foot, it's best not to have any kind of foot soak, okay? Just because you're higher risk for an infection, it increases even more. And private foot care nurses are available in the community to help you with your basic nail trimming. And also our primary care network foot programs can help you with foot education. And if you have a specific foot issue and you have a referral into our program, we would love to help you as well. So that brings us to the end. So definitely now you are the foot pro. If you listen to all that information, that was kind of a lot of foot talk, that's for sure, and hopefully I didn't overwhelm you too much. And we definitely appreciate you choosing to take the time to educate yourself on maintaining healthy feet. And Jess and I do hope you've learned something from this class, and we truly appreciate any feedback you have for us to help us improve our virtual education. And again, thank you so much for joining us. I don't know if anyone has any questions or comments.
I do have a quick question.
Yes, hi.
Hi, one of the members from the NSL Senior Drop-In did want to participate today, but was unable to. Yeah. She was asking if there was any way to get the information that was discussed today.
Yeah, that's a good question. So we are recording this session, so we are going to have it available probably within our website. We already do have this specific class, which is called Maintaining Your Feet, and it is available already on our website. It's not this exact one, but it's very similar information, and it's available on the wolfcreekpcn.com website. And yeah, so definitely anyone can check that out, and it's called Maintaining Your Feet. So does that help you, Taylor?
Yeah, it does. Thank you so much.
Thanks for joining. We appreciate it.
Thank you.
Any other questions? I think I'll stop recording here.